residents remains low, but public interest and concern is high, and there are lots of misinformation out there. This should be a period of calm and readiness as we rely on the strong collaborative partnerships we have locally to meet these challenges. Today, we've brought together some of the teams of people who are working to keep our county safe and to help you separate fact from fiction. With us, we have Dr. Paula Taki, Florida Department of Health, Broward County, School Board Member Donna Korn, Sheriff Gregory Toney, myself, my colleagues are here also, Commissioner Barbara Sharif, Commissioner Michael Udine, the Mayor of Fort Lauderdale. This is a team effort to keep our community safe. So let me take some time to talk a little bit about this issue that we face. Currently, there are no cases of coronavirus in Broward County. And there are no plans to close school or cancel public events. I want the public to be aware that the symptoms are similar to the flu. So if you're sick, stay home and follow the advice of your healthcare provider. It's been said many times, but wash your hands regularly with soap and water for at least 20 seconds. Use hand sanitizer at home and in the workplace. Cough and sneeze into your elbow, not your hands. Avoid touching your eyes, nose, and mouth. Avoid close contact with anyone showing the symptoms of respiratory issues. Again, I really want to stress, there are no cases of coronavirus in Broward County. However, we're not taking any chances. We're ready to support our community if the challenge arises. We must rely on our experts, and we're blessed to have some of the best doctors in the country that live right here in Broward County. Some of them are here with us today. The county is being proactive to prepare for any potential coronavirus presence in our community. We're stepping up our cleaning of public buildings, particularly in areas that the public does business with the county. As an example, airport cleaning crews are doing more thorough, more frequent cleanings in bathrooms and escalator and on railings. There are ongoing inspections in county buildings and public educational material directed at prevention has been placed in every bathroom and facility. Our transit fleet is being thoroughly disinfected every day as buses return for the evening. And workers are cleaning high-touch areas more frequently, including on our paratransit buses and vehicles. Public information and preventative measure is being placed throughout the system. Additionally, we have reached out to the municipalities or cities, and will continue to coordinate the sharing of verified information with them. We're taking steps to take care of our employees, ordering more resources to prevent the virus. As we take care of ourselves, we're preparing to ensure that if anything happens, we can take care of the people of Broward County. At the Fort Lauderdale Hollywood International Airport, Customs and Border Patrol is continuously monitoring passengers in our facility, looking for anyone displaying symptoms. If they are, they may be detained or isolated, and will contact the Centers of Disease Control and Prevention. They'll also look at passengers' travel history. It is important to note our airport remains fully functional. At the port, cruise lines are requiring all passengers to complete a declaration form before being allowed to board a cruise. While each cruise line's policies varies, each has applied a combination of denial of boarding for cruise and passengers originating from certain locations around the world, and mandatory health screening for passengers originating from other locations. The port's website has links to the cruise line policies and is the best source for this information. You can visit our port at porteverglades.net. That's porteverglades.net. Should it become necessary and requested by the CDC and Customs and Border Patrol, the airport and the port have the capability to easily augment screening. It is safe to travel, but evaluate your travel plans as conditions warrant. Rethink traveling to areas that are already under travel advisory or areas that are experiencing an outbreak of coronavirus. I encourage you to monitor the CDC for the latest on travel restrictions.
All right, we have been listening to a press conference from Broward County. We're going to continue to bring this to you online on the NBC6.com site as well as the NBC6 News app, so you can get all of the information and listen in there. We know you have many questions about the coronavirus, so the Florida Department of Health has set up a 24-hour hotline to address all of your concerns. The number is on your screen right there, 1-866-779-6121. And we'll continue to keep a close watch on new developments surrounding the coronavirus. And we'll see you for the NBC6 News starting at 4. In the meantime, be sure to follow us on our social media pages and, of course, on the NBC6 app.
No confirmed cases of COVID-19 reported in Broward County at this time. With that in mind, we all understand the concerns that many of us feel about the situation, and all of us are here to provide you with the most updated information to protect yourselves and your family, and also to tell you what we are doing to protect our community. We have successfully faced public health challenges in Broward County, like Zika and the 2009 H1N1 pandemic, and we will face the challenge of COVID-19 together. On March 1st, the Florida Department of Health reported Florida's first 2 cases of COVID-19. As a result, the governor issued Executive Order 20-51, and the state Surgeon General declared a public health emergency. Symptoms of COVID-19 include fever, cough, and difficulty breathing. COVID-19 spreads through respiratory droplets when an infected person coughs or sneezes. It is mainly spread through close contact within 6 feet of the other person. The period between exposure and the development of symptoms is 2 to 14 days. Currently, there is no vaccine or approved treatment for COVID-19. If you think that you may have been exposed to COVID-19, especially through travel, in the last 14 days to identified areas and countries such as China, Iran, South Korea, Italy, and Japan, or through close contact with someone who is a confirmed case of COVID-19, please immediately self-isolate. Please call your healthcare provider and call the Florida Department of Health in Broward County COVID-19 call center at 954-412-7300 before traveling to see a healthcare provider. If indicated, the Florida Department of Health in Broward County will work with your healthcare provider to get you tested. The Department of Health Bureau of Public Health Laboratories is currently performing testing using test kits from the CDC. Commercial testing is not available today, but the situation is rapidly evolving. All of us can take everyday actions to help prevent the spread of respiratory illnesses such as COVID-19, and they are worth repeating. Washing hands frequently with soap and water for at least 20 seconds, and if not available, using an alcohol-based hand sanitizer with at least a 60% alcohol content. not touching your face, staying home when you're sick, and avoiding close contact with people that are sick. In Broward County, county government, the health department, all of the partners represented here today, as well as many others, work together on a daily basis to protect, promote, and improve the health of our community. This was recognized when Broward County received the 2019 Robert Wood Johnson Foundation Culture of Health Prize. Under the leadership of Broward County Emergency Management, we plan, train, exercise, and respond together on a regular basis to be ready for such events as COVID-19. Working with our partners, the Florida Department of Health in Broward County continues to take the following actions: reinforcing important prevention messages for the public, monitoring the health trends of our community on a daily basis, actually on a moment-by-moment basis, to detect any potential cases of COVID-19, providing expert consultation to healthcare providers and the public on a 24/7 basis, coordinating the collection of specimens or collecting those specimens ourselves and making sure that they're transported to Bureau of Public Health laboratories for processing, monitoring any individuals as required. Should it be necessary, we are prepared to investigate any cases, trace contacts, and take any containment measures that are required. We are continuing to provide the most updated guidance to all of our community partners, including hospitals, healthcare providers, long-term care facilities, educational institutions, businesses and employers, and first responders, and helping them to implement that guidance. The Florida Department of Health in Broward County is working with our partners to prepare and ensure that local plans, resources, and capabilities are in place so that we can respond and minimize the effect to our community should there be a widespread outbreak of COVID-19. As you know, this situation is rapidly evolving, and the most updated guidance can be found at floridahealth.gov and cdc.gov. Thank you.
Thank you very much.